Hi, thanks for coming. My name's Shannon Van Thiel, and I'm going to do a presentation on IT governance and digital transformation. In this presentation, I will discuss the importance of IT governance within healthcare institutions, the core functions of an IT department, and how they work within an organization. Digital transformation, what it is and how important it is for organizations to survive and advance within the very dynamic healthcare industry. I'll discuss the choice of Epic as the provider of choice for digital transformation within Ashford Hospital. Finally, the difference between capital and operating budget and how it affects the implementation and digital transformation with Ashford Hospital. Within any organization, and especially healthcare institutions, IT governance is extremely important, and it refers to the principles, process, and organization structures within the institution that oversee the IT process and resources needed for a successful electronic health record. IT governance is responsible for defining IT strategies within the healthcare institution and defining the committee and their responsibilities to oversee IT functions. In addition, the IT department heads will set priorities for the IT department at Ashford Hospital. That would include choosing the electronic healthcare software, implementation, development of the implementation schedule, including training of all staff and the hardware installations, budgeting, including both necessary capital and operational, would be the responsibility of the IT governance. Finally, the IT department heads would assign responsibilities, both centralized and decentralized, within Ashford Hospital to assure a smooth transformation, continued advancement within the health record. One of the core functions of the IT department or IT governance is strategic development for everyday oversight of Ashford Hospital, but also specific to the digital transformation phase that Ashford Hospital is about to embark on. As a relatively small institution, budgeting is a priority. The IT governance will be responsible for creating, approving, and adhering to the approved budget. This would include the prioritization of choosing electronic health record software that best fits the needs of Ashford Hospital now and will grow with the institution for years to come. This new adventure will require a lot of project management to develop the appropriate plan for a smooth transition. Specifically, time management for each phase of this digital transformation project will need to be clearly defined, monitored, and followed. Finally, architecture and infrastructure management will be the responsibility of the IT governance, including but not limited to choosing the new electronic healthcare software company, but at the large task of ordering and installation of all new hardware. At this time, it's been decided that Ashford Hospital is ready to undergo a digital transformation. It is important to advance this institution and improve patient care and patient outcomes with a new electronic health record. Under the guidance of the IT governance needs to be implemented. This type of digital transformation is necessary to the organization's competitive position within the very competitive healthcare environment and to improve the overall performance of Ashford Hospital for our most important customer, our patients. In an effort to maintain our share of the market in our community, our patients must feel that they are being treated with the newest and most up-to-date electronic health record. The healthcare industry is constantly advancing in the IT arena. Hospitals rely on updated IT models to provide the best care to their patients and statistically have the highest patient outcomes. After a thorough review of the top electronic health record software companies, we believe that the best option for Ashford Hospital is Epic. The IT department head is looking at some of the current options for electronic records, looked at statistics related to the market share of the top software companies. Epic at this time has the highest market share with 27.4%. Currently, 393 institutions, including some of the largest healthcare systems, Allegheny Health Network in Pittsburgh, PA, and Johns Hopkins in Baltimore, Maryland. When looking at the most important functions of an electronic health record, it was determined that Epic not only included but met our goals and performance levels of the most important functions we were looking for. For the physicians, computerized order entry was a top priority, both in functions and ease of use. Another top priority is the ability to view records across the Ashford Hospital system for continuity of care. An expectation of patients is the ability to view their records, including test results, in a timely manner. One expectation of electronic health records is medication reconciliation. Patient acuity is always rising, and it is important that medication lists are accurate and up to date. With the Epic Pharmacy has access to medication lists to audit for allergies, medication interactions, and appropriate dosing. Summary of care records, especially in Epic, the after visit summary can easily be printed after every encounter and provided to the patient. These can also be shared to the patient portal for easy access by the patient if they have questions after their visit. The functions of today's electronic health record goes far beyond the patient's individual medical record. The electronic health record has connectivity to all aspects of patient care, billing, and research. With Epic software, they have specialized components for all specialties, including pharmacy, outpatient radiology, laboratory records, and behavioral services. The system can accommodate physicians' office charting and needs and integrated this data into the hospital records when a patient requires admission to Ashford Hospital. There are integrated prescription records for medications that can be sent to the patient's pharmacy of choice, which is stored in Epic. This function speeds up the patient's ability to begin treatment faster. The implementation of the patient portal within Epic allows the patient-physician communication. Patients have the ability to see the radiology and laboratory results in a timely manner. They can ask questions of the provider and make new appointments when needed. Because of Epic's advanced interoperability, is determined to be the best fit for Ashford Hospital. Some of the most important decisions IT governments makes is related to budget. Two important components of the budget are capital budget and operational budget. Capital budget refers to the hardware needed institution-wide to undergo the digital transformation. Taking into consideration that each year there will be costs related to new equipment needed. Also within the capital budget is the cost of Epic software initially, and then the cost to upgrade as needed with advancements in the Epic software. Next is the operational budget with this most cost of running the IT department and its related areas. With the digital transformation of the Epic system, there will be costs associated with training of all staff on the new system. The ongoing costs related to system maintenance and salaries for positions like analysts. With a system-wide electronic health record, there will be new positions needed to monitor the system, review and analyze data for research, and ongoing projects within Ashford Hospital. In conclusion, after review and thorough evaluation of Ashford Hospital, it is imperative that a strong IT governance is established, including the development of an IT department with specific committees designed to increase efficiency. In an effort to keep up with the healthcare community that we are in and provide the best care to our patients, it is time to undergo a digital transformation. Finally, after reviewing both the needs of Ashford Hospital, its physicians, staff, and all departments, it has been decided the Epic electronic health record system would be the best option. Thank you.